Now, joining the conversation with the news now from Fox Live is Dr. Anuj Shah, interventional cardiologist. Dr. Shah, thank you so much for joining News Now from Fox this morning.
Absolutely. Good morning, and thank you so much for having me again.
So, Dr. Shah, there is a lot of information floating around out there. For our viewers, can you explain exactly what prompted the pause of Johnson & Johnson's vaccine in the first place?
Yeah, so Johnson & Johnson vaccine, as some of our viewers may or may not realize, is a little bit different vaccine compared to Moderna and Pfizer. Can you hear me properly?
I can hear you, yes.
Okay, perfect. Just wanted to make sure. So yeah, unlike Moderna and Pfizer, which are mRNA vaccine, Johnson & Johnson is what we call a viral vector platform vaccine, which basically uses a human DNA from adenovirus, which is a similar virus like a cold virus. And what the way the vaccine works is, unlike mRNA vaccine, it which basically trains your body to recognize the spike protein, which is the protein on the surface of the COVID-19 virus. This one actually tried to simulate the similar DNA. And what happened is, out of around 8 million people who already got Johnson & Johnson vaccine, there were around 16 cases of a very serious condition called cerebral venous sinus thrombosis with thrombocytopenia. So what does that stand for? It's a type of a blood clot that happens in the brain where, along with your body's platelet counts, which are the sticky cells, they go down. It's a pretty rare complication. If you remember, Hillary Clinton actually had it in 2012. So, it's a very rare form of blood clot that we see. And it happened in this 16 people, out of which 3 people unfortunately died. And 14 out of 16 were in women in childbearing age between 18 to 49. So it raised a lot of initial concerns. They saw similar findings in people who got AstraZeneca vaccine in Europe. So I think that's what caused the pause in the delivery of J&J vaccine, because everyone's like, wait a second, is this vaccine really safe or not? And what is this cerebral venous sinus thrombosis with thrombocytopenia? So that's what caused the pause. And yesterday they lifted the ban.
Do you think that this was the right move to make?
Yes, I believe it's the right move to make, because you have to look at statistics as a whole, right? This is a perfect example of looking at population statistics. The problem we are facing is still vaccine shortage. And I know in certain parts of the country, it looks like we're already reaching the peak for vaccination, because people who don't want it, they're not gonna take it. But globally, there is still a tremendous shortage of vaccines. So right now, you have to weigh the risk of these kind of blood clots with the vaccine and weigh the risk without vaccine with COVID-19 itself. And the risk of this cerebral venous sinus thrombosis with thrombocytopenia is even substantially higher in COVID-19 infection. So in other words, every third, the risk of getting this, what we call CSVT as a short form, the risk of CSVT in COVID-19 patient is 39 in million, versus with J&J, the risk is around 4 in million. So the risk with vaccine is there, but the risk if you catch COVID-19 is 6 times more. Wow. So that's why you have to look at the risk. Okay, so if you get COVID-19 infection, you're much higher risk of all kind of bad things happening, including blood clots, which are very, very common. So you have to look at the risk between the two. And the US ICP panel on immunization found it pretty safe, that it's very difficult to predict who's gonna get this kind of thrombosis, and there is a small theoretical risk, but at this point, population-wide, it's probably worth it.
It seems as though the risks definitely are minimum compared to the benefits of the vaccine. However, vaccine hesitancy, I'm sure you know firsthand that this is something that medical experts have been fighting since the beginning. So although the health panel has given the Johnson & Johnson vaccine the green light to resume production and administration, has too much damage already been done? What do you have to say to those who have little confidence in the vaccine because of all of this?
Yeah, unfortunately, we're not living in a perfect world. In a perfect world, I would love that we had years to develop a vaccine. We had years worth of data, short-term and long-term data on millions of people to assess for these vaccines. I mean, J&J, their clinical studies, were as large as Moderna and Pfizer almost. So it's not like this wasn't studied. Obviously, this is a relatively new, vaccine, obviously, and a relatively new virus, and even the technology that's being utilized is relatively new. So there are going to be genuine concerns, but everything we have to take with a grain of salt in terms of we got to deal with the best that we have. And unless everyone gets immunized and we reach that herd immunity, it's going to be so difficult to deal with this pandemic, especially with this new mutation and variation we are seeing in vaccine. It's going to continue to happen unless the virus eventually runs out of hosts. So that's why I think what we got to look at, not just individual health, and that's a tricky part, right? Because everyone wants to, we know there is a risk with birth control pills, with blood clots. We know that people, when they smoke, there is a risk of clots. Clots happen, regardless. COVID-19 obviously is 6 to 10 times higher risk of clots. But those things, people feel like it's an element of control that comes into play, right? When people are taking vaccine, they feel like, okay, I have a choice, I'm choosing this vaccine and now I'm getting clot, versus, they can choose to take birth control pills and take the risk of clots, or they can choose to smoke and take the risk of clots. So that individuality of the choice, I think, plays into action. But a lot of time people don't recognize is not taking vaccine and supporting, like not using, these kind of vaccines is also a choice in basically not using everything we have in this fight against the pandemic. Vaccines are some of our biggest guns right now, in terms of prevention, in terms of making sure we reach the herd immunity. And that's why we cannot allow, this millions of doses of vaccine to go to waste, and we should truly, and there are a lot of advantage of J&J vaccine over even Moderna and Pfizer, right? We know that it's very safe to administer overall, except for the 0.001% side effect. The room temperature is amazing, that you don't need any special storing facility. And the best thing is it's one dose. So we have so many people for whom either logistically it's difficult to get 2 doses, or they just don't want to get 2 doses, and the vaccine hesitancy goes even higher because you have a second dose needed. So I think J&J definitely is a lot of potential role. The committee did not put any restriction, but I think later on, the CDS and FDA are saying that if there is a warning now on the label for if you're a woman between 18 to 49, there is a small, very, very small theoretical risk of, the CSVT. So you have to take it with a grain of salt.
Now, Dr. Shah, you briefly mentioned the correlation between blood clots and the COVID pandemic in general. Could you elaborate for us?
Yeah, so COVID-19 is what we call hypercoagulable condition. There have been hundreds of thousands of patients who got COVID-19 ended up getting blood clots in all various organs, including lower extremity being the most common. And we actually just recently published a paper on one of our COVID-19 patients who got clot at the same time in his arteries, his veins, and the heart. So COVID-19 causes this clotting disorder by a number of factors. There are this receptor upregulation on what we call the ACE inhibitor receptor. So this receptor gets upregulated. Oftentimes people don't move much when they get that COVID. So it's what we call Werkow's triad, and COVID impacts every possible action, causing this massive immune reaction, which leads to blood clots. So there are also case reports of blood clots in other circulation system, including portal veins, splenic veins, which is the abdominal area, very similar to the 1 or 2 cases that got published in NEJM with the J&J vaccine, which started this whole controversy. And then obviously intracerebral clots as well, including the cerebral sinus venous thrombosis, the very condition we saw with the vaccine. So COVID is a very hypercoagulable condition, and routinely we put people on prophylactic blood thinners when they get admitted with COVID. And if we have any markers suggesting clotting process, we put them on therapeutic blood thinning medications as well.
We now have 3 vaccinations. Mandates are dropping across the country, and slowly but surely it does seem like the world is reopening in a sense. And last time we talked, we had a conversation just about the mental toll that is taken on the medical community as a whole. Are you now finding that you have a sense of relief that maybe we are looking at the end of what's been a very long COVID-19 journey?
I hope so. I'm keeping the fingers crossed. It's very sad that in the US I think definitely the curve's going, in the right direction for us, and we are hitting the plateau. But worldwide, and I'm from India, so I have to mention this because right now people from India are really suffering, and the crisis has gone to an absolutely crazy, disproportionate level in India, partly because of not having enough resources. It reminds me of what we went through last year. Right now there is incredible shortage of beds. They don't have enough oxygen, and the death toll has gone through the roof. There are cities in which you can't even find graveyards for people. So
Wow.
it's been really bad condition, and now they're saying there is a new variant in India that's coming out. They're calling the Bengal strain. The same way what we saw the UK strain and South Africa strain. So there are concerns, that globally the disease hasn't really gone. In the US, I think the vaccination has really reached almost its peak, I would say. Right now in cities like New York, you can basically walk in and get vaccine. So it's phenomenal, and people are getting vaccine. We are also lucky that we are hitting summer right now. People are going to be more outdoor overall, and which is in the temp. We also know that the virus doesn't love warm temperature. So their climate certainly plays a role. The fact that people can be outdoor play a role. So I'm very optimistic that in next several months we're going to see dramatic drop in the numbers in the U.S. And hopefully, people get vaccinated and we reach the herd immunity very soon. Around 70-75%, at least in the U.S. Globally, I think we are really behind, and that is a little bit of a concern that this virus could potentially come back, right? I mean, it could have a variation once people start going more indoor in like fall and winter. Hopefully by winter it's already gone, but by fall, if people are spending more time indoor and the close proximity, it can potentially come back. So I think we have to be very careful. A lot of people want to just be done with it, and I totally get it. Medical community, also people like doctors, nurses, we all want to be done with it.
Yeah.
But this is a marathon. This is going to be a long fight. We may need a booster dose. There is definitely concerns about that immunity may kind of fall off. There are also case reports people getting COVID on vaccine. It's definitely less serious than without vaccine, but nothing's perfect. So we have to deal with what we have, and hopefully everyone works on it together and we get that herd immunity.
So we're not out of the woods yet, but I'm glad to hear that you sound optimistic about the pandemic as a whole. Before I let you go, Dr. Shah, are there any final thoughts that you would like to leave our viewers with, particularly the viewers who are tired and ready to get back to a new normal?
Yeah, I would say that keep the fingers crossed. Don't let fear play a role. There is an impact of fear that plays a role. Especially with this vaccine and vaccine-related news. Our human minds are such that we immediately go on. Anytime we hear something bad happening with vaccines and stuff, we kind of want to focus on that. So impact of fear plays a role. Impact of impatience. We are holding tight up until the finish line. Finish line is almost there. So let's not allow our fears, our impatience play a role. Let's be resilient. I think globally we see that this disease can be very dangerous, and things can be a lot worse. We are lucky, in the sense that in the last few months, again, obviously in the US we suffered from a tremendous death toll and number of cases, and still we are seeing people with COVID. So let's keep those who are suffering from COVID and those whose family members suffer from COVID in our prayers. Let's focus on doing the right things. I can't end without saying social distancing, mask, keep the distance from each other. Try not to ventilate within the same space. So if indoor crowding is still a little bit of a concern, so keep distance and get vaccinated.
Dr. Anuj Shah, thank you so much. Always a pleasure to have you on News Now from Fox.
Pleasure is absolutely mine. Take care.
And we'll be right back.